Hi everybody. Firstly, I'd just like to really apologise for the delay in this start. We had a few technical issues. I'm sure you can all appreciate 365 is causing us some issues initially. I'm Joanne Pepper and I'm the Staff Governor for non-clinical staff as well as the Chair of the Membership and Engagement Committee. I became a governor at Liverpool University Hospitals to give something back to the NHS. It supported me through my profession and offered me opportunities that I would never have thought possible when I was at school. The trust trained me and enabled me and developed me and gave me a great career. What I enjoy most about being a governor is meeting people from different disciplines within the trust and working with key partners across the Mersey region. I've been able to learn so much from and about our governors and teams within our trust. Whilst in recent time the pandemic has impacted on some of our work, I've been able to speak up on key issues affecting our staff and share knowledge with the governors on the role of the sometimes unseen workforce who do so much for our patients every day. As a governor, it's the council's role to be the voice and feedback to our members of the board and directors and influence decision making and plans. I would encourage everyone to look at becoming a member of the trust and to be informed on the latest trust news as well as other exciting opportunities such as exclusive membership events. We would like to welcome those in attendance today, sharing the benefits of membership far and wide, and a link of our website and further information can be found in the chat box. I will like to hand over to Sam Holden, who is presenting today's instalment of our exclusive membership event on menopause awareness. I hope you enjoy it. Thank you.
Hi everyone, so my name's Samantha Holder. I'm an occupational therapist within the occupational health and wellbeing team. So today I've been asked to just do a little bit of menopause awareness session for everyone. Is everyone able to hear me okay? And can everyone see the presentation? Okay, so what I'm going to run through is some little bit of an awareness on the menopause, what it is, hopefully answer a few questions for people. If you've got any further questions, I'm happy to answer them individually. And then what we do and what we can do as an organisation. So first of all, I'm just going to talk a little bit about what the menopause is. Okay, so the menopause is when your periods stop due to lower hormone levels, and it usually happens between the ages of 45 and 55, but it can sometimes happen earlier naturally, or potentially you've had a hysterectomy or been on medications like chemotherapy for cancer. So removal of the ovaries or the uterus are your main ones. There may be a genetic reason, and sometimes the reason's unknown. You know, we have been known for it to be a stress-induced or anxiety-induced. The perimenopause is what happens pre your period stopping. So you may get changes in your periods, you may get some of the symptoms of menopause, and that's kind of your awareness that something's potentially happening. Menopause is when you've not had a period for 12 months. And then we've got post-menopause as well, where you can have some ongoing symptoms. So first of all, I just want to talk to you about the stages and symptoms of menopause. So we've got the premenopause, which is the normal productive life. Your periods may be regular for you. You may have difficulties anyway. Then you have your last regular period, and your periods may be all over the shop, different levels. You may have all these weird and wonderful symptoms, which we'll talk about, and then you'll have your last period, and that's when you hit menopause. So actually, majority of the people that we're potentially talking about, we might be talking about the perimenopausal, and then your postmenopause is when everything should start to ease off. Some of them symptoms, you might be left with some lasting difficulties. Okay, so the perimenopause is when you're getting your strongest amount of symptoms. So I thought I'd separate things up into your physical symptoms and then like your mental health and your cognitive symptoms as well. So the common physical symptoms include your hot flushes, which can also make you feel dizzy as well, difficulty sleeping for a variety of reasons. This could be related to the hot flushes, it could be related to anxiety or some other symptoms, it could be related to the joint pain, but equally if you struggle sleeping, it has a knock-on effect to the next day. Palpitations, and this can be quite worrying for people, so it's when your heartbeat suddenly becomes more noticeable. Headaches and migraines that are worse than normal, your muscle aches and joint pains, and I'm going to cover that a little bit more because that's something that we see quite common. Changes to body shape and weight gain. Again, I'll talk about this in a little bit more detail. Skin changes, including dry and itchy skin, reduced sex drive, vaginal dryness and pain, itching and discomfort during sex, and recurrent UTIs. The reason why the menopause interests me from an OT point of view, and I think you'll find a lot of OTs within the remit will find this a key area to work with, because it covers so many symptoms that affect every day of your life. They affect so many different areas of your functional life that we tend to be quite well placed to be able to support you with this. And it's not about often supporting symptoms in isolation. It's about looking at it as a whole from a holistic point of view, because a lot of them overlap, they're quite interlinked, and we can't really tease them out. Okay, so you can probably see that just from talking through the physical symptoms. From a mental health point of view, and I'll put cognitive in there, the brain fog, the attention issues, it's common to experience quite significant mood changes. I mean, during every time of the month you can experience some of these, and all that's happening perimenopause and menopause is just an exacerbation of some of these symptoms. So from an anxiety point of view, irritability, can be quite angry and quite aggressive, and just feeling that your tolerance is gone. Sadness and low mood, which obviously has a lack of motivation, this aggressiveness, problems focusing and concentrating, which affects your memory. If you're not able to pay attention, you're not able to remember things. So actually it's about taking it back to the basic thing that you're struggling with. And stress can cause all of the above and exacerbate problems of your menopause. So it's like this cycle of all these symptoms just affecting each other. So it's much like constant premenstrual symptoms. These affect emotional strain, and the impact of low self-esteem and low sense of worth can be quite key. I just wanted to mention here about the andropause. So this is the male equivalent to menopause, and it is a hormone decline, so especially testosterone. Some of the symptoms are similar, so it's not to forget the male side of this, really. So a low libido and loss of interest in sex, erectile dysfunction, low energy levels, weight gain, muscle loss, mood swings, hot flushes, urinary problems, and metabolic syndrome, which is a combination of medical problems. So you normally have obesity, high blood pressure, unhealthy cholesterol, and insulin resistance. And these happen in the same time period, really, the same age. You tend to see a lower decline in testosterone than you do in women. Women's tends to be a lot more fluctuating, and that can give rise to the symptoms becoming worse and more inconsistent, which is why it's often difficult. The andropause is often mismanaged in men, but it's something to be aware of. I just wanted to consider it. So hormone replacement therapy is the choice of treatment, and basically all that is it replaces your body's levels of estrogen levels. And there's different types and doses of HRT, and it's about often twiddling with the correct dosage and the correct usage and the correct type based on you to help you with these symptoms. And it can come in a variety of ways, so skin patches, a gel or spray, implants or tablets. If you've still got a womb, then we're looking at the combined HRT, so progesterone to protect the lining of your womb from the effects of the estrogen. So taking both, that's called combined HRT. Progesterone comes in patches into your intersystem, or a coil, or potentially tablets as well. So you might have trialed different, they might work differently for you, and it might be that you just need different levels, in which case that might lend itself more to a different treatment, a certain treatment. There may be cases, so the risk of HRT obviously have been quite well displayed in the media in the past, but often the risks are small and outweigh the benefits, and it's about chatting to your GP about your past medical history of family members, to discuss what the best course of treatment is for you. And it may just be down to choice. You may choose that you'd like to manage it without HRT. So it's about treating some of your symptoms then. So it might be hot flushes, there's different medications for your blood pressure, and gabapentin for epilepsy, and antidepressants that can actually help with hot flushes too. osteoporosis is often something that we can see quite a lot and be quite concerned about people that haven't been managed through the menopause with hormone replacement therapy, because your bone density reduces as you get older, and the menopause really exacerbates this, and then that has an impact on you. You know, if you were to fall, you're more likely to have a fracture. We're looking at your bone health and your physiological musculoskeletal health. So we need to be looking at how we can improve your musculoskeletal system and osteoporosis if you choose not to have HRT, or if you can't have HRT. And that's through diet and exercise, and potentially supplements, vitamin D, vitamin C. The cognitive and mental health side of things. So we've got, obviously the main thing that we see is anxiety management, is anxiety issues. So we can look at anxiety management, behaviour activation, and cognitive rehab. Sorry, I think it's been a bit of an issue. Oh, okay, the fan. So sorry, didn't even think of the fan. We're sat in a boiling hot room in here. Okay, so yeah, from a cognitive and mental health point of view, we've got anxiety is the biggest thing that we get. But then within that low mood, we may be looking at behaviour activation. And there's cognitive rehab that we can look at. So we're looking both at like the compensatory strategies that can get you through the day and can support you with your memory lapses and your attention. But equally, we're looking at, well, how can we rehab your brain? How can we keep you active? So all these things that we can be looking at. And vaginal dryness, we're looking at lubricants and moisturisers. There are ones that are estrogen-led creams, but their level is such a lot lower to obviously the tablets or patches. So it might be that that's something that would be suitable for you. So I wanted to just touch on a few of the main concerns that we see and that people mainly complain of. One of which is anxiety and mood management. So as we age anyway, our cortisol levels increase, which can cause stress. You know, you hear a lot of people say, I wouldn't struggle with this back in my 20s, whereas now it's really getting to me. But then equally, stress causes cortisol to increase. And when you're in the menopause, that causes cortisol to increase. So we've got all these confounding things all causing the same issue. So it's about managing your anxiety and learning the strategies to be able to be more resilient. Life changes around 40. So things happen, you know, parents, you might have more caring responsibilities. Your children might be looking at moving on. They have an impact on your mood. You know, if we take the menopause away from that, we've still got a lot of issues going on. You might be at the peak of your career. We often get a lot of people saying, you know, I've been really successful in my career. I've made it to this level, and now I cannot do my job. I can't function at the level I were and I could do. We've already talked about carer responsibilities, but world changes. You know, we've had a dreadful few years, everyone, and this is going to have an impact on you. So it's just an awareness of what else is going on that's going to have an impact. So what can you do? A lot of it's about acceptance. You know, the worst thing you can do is tell somebody else, oh, come on, pull yourself together, you're all right, everything will be fine. Actually, the best thing you can be saying is, I can see you're really upset, I can see you're anxious, but we don't tell ourselves that often. So, you know, accepting that you're feeling anxious, accepting that you're feeling low, and talk about it, because if you repress that feeling, your brain just wants to problem solve, and it carries on and on and on trying to solve the anxiety or whatever's happening. We're looking at breaking that negative thought and behaviour cycle, and that's something that we'd work with you with if you were to have like a one-to-one, or you were to come to us for some help. So it's often what judgments you might feel, or what you might feel other people can impact you, and we're looking at cognitive behavioural strategies there. Calming strategies, so it's about noticing the physiological symptoms. That's the first thing that's beneficial to do. Often with anxiety, it's the fight or flight response. Your heart rate increases, your breathing rate increases, and then that causes the behaviour and the actions. And if you can break that cycle by actually calming your breathing down, which will calm your heart rate down, your brain will be told everything's okay. You know, there's no need for us to be anxious, and you can calm yourself down. Sensory strategies as well. You know, there's often people say, I've got a bit of a sensory overload. I can't concentrate where it's busy. I can't focus on the things that I need to do when I've got too much on. So it's about looking at what you best need to be able to help yourself. Exercise, We'll talk a bit about that with regards to joint pain, but that can help across the board really with your mental health, with your physical well-being, and with your menopause symptoms. Behavior activation is about just setting yourself meaningful activities. So thinking about what you want to be able to do, and then that will be your focus. And it's about often setting yourself a plan to do it. The motivation's lacking, but actually if you've got a graded plan of how you're going to improve doing things, you'll have that benefit, and you just reflect on that benefit and take that forwards. Sleep strategies. So often, you know, insomnia is something that comes through quite a lot, but equally just the things that affect your sleep are anxiety and pain generally. If you're struggling getting to sleep or waking up often, them are the two things that we will consider and talk about. So it's about having a really nice sleep hygiene program before you go to bed. So, you know, just like you'd help get a child to sleep, you need to do self-care for you. So often we stop doing what we're doing and we go to bed rather than actually having that relax time for 45 minutes where we do the same thing every single night and we follow the same strategies that can help us to be able to sleep. Setting yourself some worry time can be really, really beneficial. So it might be that before you leave work, you have 10 minutes at the end of the day where you just write down a to-do list, anything you need to do. So then at night or other times when you're starting to feel anxious about that, you reflect and go back to, I've already dealt with that, that's left at work, I don't need to worry. And the same of an evening, you might have 10 to 15 minutes in the middle of the evening away from your front room or where you'd normally relax and chill, and away from your bedroom where you'd sleep, in your dining room or your kitchen or your hall, and you just might write down everything that's worrying you, and if there's anything that you can proactively do about it, what can you do? If there's not, you kind of need to learn to live and let live for that. That's out of your control. And just actually acknowledging that can be really helpful. And acceptance and self-kindness. All too often, I should be able to deal with this. Why am I feeling like this again? They didn't struggle as much as I am. It's really difficult. You are struggling and it's okay. And it's about accepting that. So joint pain's another one that comes up quite a lot. Aches and pains are inevitable as we age, but as women approach the menopause, I'd say that joint pain is one of the most common symptoms. It will increase your risk of osteoporosis and reduce your muscle mass, which is sarcopenia, and it'll increase the prevalence of OA, and that's generally due to the fact that we've got a lot of collagen that's required, and I'm going to talk through that because it's important to understand what you can do about it. The joints that generally are impacted are your hips and your knees from walking, standing up all day, but equally your hands, upper limbs, which are used for functional activities. Shoulder issues tend to be something that we see a lot. We don't lift our arms above our heads once we pass a certain age. We don't do handstands. We don't reach above our head. Everything's kind of within this remit. So we get stiffness in our shoulders. So there's a number of causes for joint pain: hormonal changes, weight gain, diet, stress, poor posture, and an increased sensitivity to pain. We'll talk through them a little bit now. And it's estrogen again that plays an important role in collagen fibres, and in your tendons they're mainly made up of collagen. So if that's depleted, you're more likely to have an injury or find it more difficult to recover after you've done exercise. It's responsible for regulating fluid levels in your body as well. So if the levels of hormones are low, you're less able to hold water, which affects hydration and lubricant of your joints, your cartilages, your ligaments, and your tendons. And fluctuating levels of estrogen can cause low-grade inflammation. So you're getting these just dull, achy pains, uncomfortable. The key to it is strength training. It's really important. So doing weightlifting, Pilates, yoga, that's you're putting weight through your joints, can stimulate tendon growth. And then, as we've already said, you know, you need that you need the collagen within your tendons. So if you can keep your tendons strong, you're less likely to get weak joints and bone on bone grinding, which can cause you to get arthritis. So it's important to pop that into your regular routine. Stress causes your body to release high quantities of cortisol, as we've already said, and that hormone is also an inflammatory agent, which can cause your joint pain to be worse. Stress causes muscles to tense up, and we mentioned posture before, and then you have to work harder. So your joints are working harder to be able to sustain your posture. And if you're stressed and tense, your muscles are switched on, which again causes more inflammation and more discomfort. So there's just a big picture, isn't there, where it's all interlinked. So suddenly we're going on to a DSE assessment and making sure that you've got good seating. So there's a lot to consider that's often missed. And I think that's what I wanted to get through on this presentation. So weight gain, diet and joint pain. So the hormonal changes of menopause will make you more likely to gain weight and to carry it around your abdomen, around your belly, than around your hips and your thighs. But hormonal changes alone don't necessarily cause the weight gain. It's often related to aging, lifestyle and genetic factors. But there's a few things you can obviously look at. Everyone goes off carbs. Carbs are important, and they're important with weight gain, but they're not the only problem. And especially from a joint pain point of view, sugary foods, high salt and processed foods, caffeine, fizzy drinks and dairy can all trigger inflammation. Now, if I'm thinking that I've not had a very good night's sleep, I might be tired, I might reach for a coffee, a fizzy drink. If I've not got energy, I'm feeling a bit sluggish and a bit fed up, I might reach for a chocolate bar. I might reach for processed foods because it's quick and easy. And you're just in this cycle again of not looking after yourself, and it's that benefit, but understandable. I think that's what it's this cycle that people get into. So it's aiming to reduce your intake of saturated fats, keeping red meat, dairy and eggs to a minimum, because they can contribute again to inflammation. Processed foods should be limited, as basically there's just not enough nutrients in them. So if you're eating them, you're filling up on non-nutritional things rather than more nutritional, and it can then increase achy joints, and they're often full of salt. Some main carby culprits are white flour, flour baked good, white rice, white bread, sources of refined sugar. So there's easy fixes to change to whole grain, beans, and other sources of what you'd normally have with your carbs. Quinoa, and you can get the packages now, so you can get it more effective and affordable and quick to do, which is often the key, isn't it, with high fat fatty foods. Seasoning the food with salt is an interesting one. So obviously salt can knock off your electrolyte balance, and then that affects the hydration of our muscles and joints, and then can hinder hydration levels, which can then cause headaches, fatigue. So we're back onto the same symptoms. So it's just things that you can do to look after yourself. Drink. I don't think we drink enough water in the hospital. I think it's really important to keep hydrated. And I'm not saying to not have treats. It's hard to resist completely. And if you've got a sweet tooth, but it's looking at alternatives and what's more beneficial for you. So work in the menopause. There's no specific legal requirement for employers to actually have a workforce menopause policy, but you are covered under other relevant legal responsibilities and other acts. So the Health and Safety at Work Act, which requires all employers to ensure that they're looking after their workers. Under the management standards, we have to do risk assessments, and that's specific to people who are going through the menopause. And the Equality Act obviously prohibits discrimination about people, and menopause meets the defined disability under the Equality Act of a physical or mental impairment. It affects you long term, so it's anything that's over a year, and it also affects your ability to carry out your day-to-day activities. So, you are covered, it's just specifics. And we're looking at the best course of action, really, from a trust point of view. I've got a couple of menopause policies that we're looking at the minute, and we've just got like a menopause toolkit that we think might be a bit more appropriate to be able to pull, and then it'll be covered under the other legalities. Supporting staff through the menopause. So it's about considering the person, it's about being individual and personalised. Not everyone will struggle the same. Not everyone will have the same symptoms, but not everyone's in the same job and the same requirements and the same environment. So it's looking at that person specific. Uniform is something that comes up quite a lot. They're quite thick, they can be quite restricted, they can be quite tight. We'd be considering access to the toilet, access to water, somewhere to rest, somewhere to have just time out. That 5-10 minutes even can mean the world. Accessibility to healthy food. We're working with sustainability, and that's something across the trust that we're looking at. The storage of food, being able to have somewhere to store your food. Working long shifts and nights is something that might come into play and be a consideration that we might look at needing to change. The flexible working policy, which is currently in progress, and we're looking at on specific wards and trying to be a more flexible workforce. Supporting the mental and physical health, and I think that's the key, is that we're looking at both sides of it. and we're looking at specifically anxiety. We know how to help it. If that's something that's an issue, we need to be looking at all the different strategies and everything that we've got as a trust to support you and making sure that you're aware of it in these signposts. Health and safety checks, so making sure the environment's okay, that it's not too hot, that your requirements of your job, your equipment that you need to use is in good working order. Training for managers and colleagues is an important one, and that's something that we look at across the board. Sickness absence management, it can be a reason for sick leave. So if you were to ring in, it's on ESR as a reason for leave. Myself and Tracy were having a chat about this before, and that actually you might not know that what you're ringing in for is a menopausal symptom. It's difficult to quantify, isn't it? If you've got a headache, is that just a headache? Is it a symptom of menopause? So it is difficult, but as a trust, we are trying. Okay, does anyone have any questions?
Okay, Sam, so we have received some questions into the Q&A box. So I will just read those out to you. So the first one is there anything to do with sleep routine or environment that can make sleeping easier?
Okay. Yeah, so with regards to a sleep routine, there's something called sleep hygiene. You could Google it and have a little look, but what I would say is it's about making your sleep area and environment. Can you hear me okay? Yeah, it's about making your sleep area and environment conducive to sleep. So I'll take you back to children. You want to make sure that room's cool. You want to make sure that it's dark. You want to make sure that you are putting all the strategies in place so that child knows that it's time to go to bed. We don't do that. So things like a hot milk, a banana, they increase tryptophan, which can help. It's like the sleep hormone that can help with sleep. So little things like that can help. Nuts have got tryptophan in it as well. Often we're trying to stop all the reasons why you might wake up in the night. You might wake up because you're hungry. So if you're making sure that you're having a light snack before bed, making sure that before you sorry, can I just pass that over? Thank you. That you're not on your phone before bed. Blue light can stimulate you to be alert. So you can get little red lights. Instead of we go into the room, don't we, and we put our light on, we put our main light on, and we've woke ourselves up as soon as we go into the bedroom. If you could have a red night light that's in your room, nice and calming. Again, red can simulate that hibernation mode. Having a self-care routine. So things like even as simple as cleanse, tone and moisturize before you go to bed. You're getting all the sensory input from that. If you use the lavender spray, anything like that can really help. They're the separate from menopause, it can really help you sleep. Within menopause, I'd say the main reason what people will say is it's I'm too hot, I'm having hot flushes, I'm overheating at night. So you want to look at your bedding, making sure that you've got maybe a sheet as well as a blanket, as well as a quilt. It's something that I remember my dad tucking me in when I was little. There's a sheet on my bed. No one seems to have sheets on the bed now, so you can have a sheet on instead of a blanket. Looking at your nightwear and what you're wearing and making sure that it's conducive to being cool. Cotton is something that obviously doesn't absorb the heat. That can all be really helpful. Having a water spray it on your ankles, on your wrists, can help to cool your core body temperature. Opening the window before you go to bed and putting a fan in front of it. You can also get little air conditioning units that can be really helpful. Pain would be the other thing, is that looking at, are you waking in pain? Is it joint pain? Is it comfort? They're the type of things that you want to be looking at. Okay, hope that was helpful. Any questions, you can always email me and I can help further.
Okay, we have received a couple more questions, Sam. So the next one is, as a man, this is something of a taboo subject. What advice could you give to men in terms of best providing support and understanding?
Okay, so I'm going to make an assumption here that this is to help either a colleague who's maybe suffering or to help a partner who's suffering with the menopause. Listening, I think just listening. I think sometimes we can try and solve everything, and we can't solve everything. This is a situation that people are going through. You're going to have that well-being conversation with the individual, listen to what their problems are, reflect on them problems and come back with some meaningful solutions. So it's about giving time to that individual to just offload often. I think some of the queries that we get is, how do I approach it? I think that this colleague is going through the menopause. I don't know. They're not saying it. It's about trying to have that openness in your department. If you think that, you know, communication's potentially an issue around the menopause, then it's something we could maybe facilitate. You know, training within the department and making sure that them open communications are there. We don't have menopause champions, but we've got a lot of wellbeing champions around the trust that we're sending a lot of information on this. It might be that you could look at a buddy system. Is there someone they can talk to? Do they have all the reasonable adjustments in place? Ask them what they think would help, and take it from there. It is a to-do, and I think it's both ways. I think it's a to-do for men, definitely, because they don't feel they can understand and they can empathise. They definitely can't. You know, I've not gone through the menopause, and yet I can still understand and empathise with people. And I think, yeah, the key is listening, but equally it's about the individual feeling they've got a voice to be able to say, I am struggling with this right now, and I think it's the menopause, or this is my symptoms, and that's difficult. Trial and error, seeing what works. But if there's anything we can help to try and break them boundaries, drop me an email. Happy to see what we can do.
Okay, so we still have, we received about 7 more questions. I'm conscious we may not have time to get round to all of them. So those questions that we've received that we're not able to provide an answer to, if I liaise with you, Sam, and then we can send out answers to those who are registered today. So if we just do one last one. So we've had a question through saying, I've been prescribed continuous HRT, but I'm still having regular periods. I've read that I need to have breaks to look after my endometrium, and I've not started to take it yet. What should I do?
Okay, so the progesterone's there to try and help that, with regards to the estrogen and balance. I would suggest talking to your GP and asking what the best course is. They're the ones that prescribe it. They're the ones that know your medical health. I wouldn't like to specify and give medical advice. I would speak to them and definitely advise what they think. We can read a lot on the internet, and Dr. Google's brilliant and awful at the same time. I would suggest that if you've got concerns, book in with your GP and either speak to one of the specialist nurses or someone about what your concerns are, and they can set your mind at ease. It kind of depends what you're on and what worries are there, really. So sorry to not really fully answer that, but I wouldn't feel confident enough on your situation at the moment.
Okay, that's great. So all of the other questions that we have outstanding, they will all be responded to, and a compilation will be sent out to everybody who is registered today. But thank you everyone for joining, and big thank you to Sam for providing that presentation to us. It was really, really useful.
No problem. Thank you, and enjoy the rest of the day. Bye now.